think that this is another thing that Melanie had in common with Mother Jones, that it's time to pray for the dead and fight like hell. So it's hard sometimes to figure out exactly where we are in the struggle that significantly expands our civil and human rights. You know, we set goals, we look for markers, we know what legislation we want to pass and what we want in it, and all the while we're in this battle, and we really do get fatigued. It does wear us down a bit. So I'm going to talk a little bit about healthcare, because that is the urgent battle that we have victory really close. It's within our reach. But out of honor, if there are folks in this room and your real battle is public transportation and the environment, just substitute your fight. You know, we're going to talk a little bit about healthcare. Because what we're going to talk about right now is healthcare. And one of the most important aspects of Melanie's leadership is that she truly understood the power of her personal story and what that story could bring to the political process. Melanie was generous and fierce in telling her story, whether it was at rallies or on TV or to the newspapers, or when a congressman made the mistake of inviting her to his or her forum. Melanie took him up on it and used her story. And our stories matter, because at the end of it all, we really know that we have a broken healthcare system that isn't serving our families, because it's our personal experience. We have Melanie in our lives. We have so many people who are suffering under the current healthcare system. Recently, I read that Gandhi thought that deep understanding between working people and insistence upon our values in every act in our life was the way that we could unlock corporate power. So in India, it was the British East India Company. It was a company that was oppressing the Indian people, taking away their rights, changing the economy, and later Britain stepped in to protect its corporation. And the company was winning and taking over the country from the people by pitting different villages and different castes and just different groups against each other and sowing mistrust and fear. So the corporations were telling us not to trust each other and working us against each other so we'd be afraid of our own community. Does that sound a little bit familiar? Yes. So in so many struggles that precede the struggle that Melanie led, there's this common tool. The power of our stories, our common conditions, and our relationships to one another. The fact that families are talking to families, working people to working people, organizations to organizations. Melanie was, as Ramona said, connecting us all to be in relationship with each other, clear about our stories, clear about what we need, and ready to fight. So what's next? Melanie's story has been so compelling and so powerful and so clear that her life is a beacon helping to guide the movement now throughout the country. So there is going to be a national march, and I didn't do this, there's no one in Missouri who did this. There's going to be a national march that starts this week in Philadelphia, and folks are walking to DC, and they're calling it the March to the Finish Line for Melanie. Who have lost their loved ones, who themselves are uninsured or suffering with a pre-existing condition or unable to afford care. And they're going to be doing that. In the 21st century, so I want to give us a little bit of equipment so that we can fight too, because it's not going to be 500 or 1,000 people walking from Philadelphia to DC that wins this fight. It's going to be each one of us doing our part right now. In the 21st century, these human rights struggles have a different challenge. We're getting disorganized and confused by blogs and the 24-hour news cycle. So I've got some really important news for you, and something that, like Melanie, we've studied and studied. Healthcare reform is not dead.
That's right.
But more than ever, we need a disciplined movement of leaders and activists, just like Melanie did for many years. Stay on message, always show up, and always be ready to fight. That's what we need for the next few months. So John Prine has this folk song that I love, where it's like, blow up your TVs, throw away your papers. Blow up your TVs, throw away your papers, and just fight for healthcare reform. Don't listen to everybody trying to disorganize us. We're closer to comprehensive healthcare reform than we've ever been in the history of this country. want to be really clear. At this moment, we're also closer to losing than we've been in the history of this fight. And that's because Congress is stressed out. They're afraid of the election, and they're paralyzed because there's mistrust between the House and the Senate. On the national level, the President himself is calling them together and trying to organize Congress, organize the House and the Senate with the administration to come up with a firm plan to get this done, to get comprehensive health reform to the President's desk. So here's what our job is. The President's organizing Congress. Here's what we have to do. Two things. We have to keep the yes votes in Missouri's congressional delegation, and we have to poke at the no votes. As it comes down to those final moments of this struggle, all the powerful forces, those insurance companies, those for-profit corporations, are going to be trying to peel off votes and turn votes. We have to be vigilant in keeping our Missouri delegation on the side of our families, on the side of comprehensive health care reform. That's a role that we have. The other thing we have to do is educate and mobilize the public. Talk to our friends, talk to our family, talk to our coworkers. I know we're tired. I know this has been a long fight, but we have to create a huge buzz around healthcare reform must get done. A bill must go to the President's desk. So ask your pastor to pray for the uninsured and those who are struggling with medical debt and services. Call into talk shows and call your congressperson daily until a bill lands on the President's desk. Very quickly, the basis for reform is the Senate bill. That bill has to get passed by the House, and then it can go to the President's desk and become law. We're one House vote away from comprehensive health care reform that is the most sweeping health care legislation that will ever have been passed in this country. In addition, there are going to be some fixes that can be put into a separate bill and can pass through the House and go to the Senate, and all it needs is a simple majority. Some things that can go through budget reconciliation. So there is a path, there is hope. Don't let all the naysayers cloud your mind. What's in the Senate bill? I'm only going to tell you that in all the years that I've done this, and in my 3 years in this fight, I never expected to get reform as far-reaching and comprehensive as what's in the Senate bill alone, even before we fix it. And there are two things I never thought I'd see. Significant sweeping insurance regulations and a significant coverage expansion. 30 million people who right now don't have health insurance will have affordable coverage when this bill is passed and implemented. 30 million people, just like Melanie, who at times in her life could not get health coverage to actually cover her, the health care, preventive health care and screening that she needed. 30 million people. And only because Melanie was very clear that insurance companies have to be reined in, they have to be squeezed, until eventually we squeeze them out of the system. Not this bill. Just to know, because Melanie would want us to fight for this. In the Senate bill, insurance companies will not be able to turn us down or charge us more when we have pre-existing conditions. They will not be able to drop us when we get sick. They will not be able to rate premiums by gender, so they won't be able to charge women more than men. They'll have to report how much of the premiums they take in they spend on medical care, and if they don't spend 80 to 85% on medical care, they have to give us a rebate. There's been so much argument and so much misinformation that we forget what's in these bills that is phenomenal. It's revolutionary. Insurance companies will have hard caps on our costs, including limiting deductibles. So a single individual will have plans that have deductibles of no more than $2,000. That's a far cry from the $5,000, $10,000 deductibles that are common now, and that's what happened to Melanie. She had too high of a deductible to get care when she needed it most.